One moment.
And Larry, you'll give the update on how to listen in Spanish and Haitian Creole and sign
Yes,
language?
we're live. I believe Josh is going to give those instructions.
All right, well, good evening, everybody, and thank you for joining us tonight. We have this very, very important town hall meeting. As you know, the pandemic in the city of Norwalk, the state of Connecticut, and around the country is trending upwards, which is a very troubling trend. But also with a bit of good news is that both Pfizer and Moderna have developed vaccines that have shown to be 95% effective. And those vaccinations will be starting to be administered throughout Norwalk, Connecticut, and around the country in the coming months. And we wanted to give everybody an update on what to expect, some timelines, and how we're going to get this message out. This is a task force that I've created. It's comprised of a cross-section of the community. The task force is going to be focused on two issues: planning and logistics, where, for instance, the vaccine will be administered, who will be administering the vaccine, what resources they need in order to do so effectively, and taking care of the numbers of people that will want to be vaccinated. And also communications and outreach is the second arm of this task force. So we want to make sure that people are aware of everything that's going on in the city of Norwalk. Also, we want to give information to people so that they can make an informed decision. We know that right now some people are reluctant, not thinking they may take the vaccination, but we want to give people information so that they can feel comfortable or they can determine whether or not they want to take this vaccination. So we're going to welcome everybody. I'm going to introduce right now my my communications director for the city of Norwalk. He will give instructions. This broadcast is being presented in Spanish, Haitian Creole, and American Sign Language. Josh?
Good evening, Mayor, and good evening, everybody. Thank you for joining us for this very important town hall tonight. As Mayor Rilling had said, tonight's town hall is being broadcast in English with live interpretation in Spanish and Haitian Creole, as well as American Sign Language. To listen in Spanish or Haitian Creole, please select the interpretation button on the bottom of your Zoom screen, and then select either Spanish or French. Please note that hitting French will actually be the interpretation for Haitian Creole. Tonight, there'll be some brief presentation from members of the Mayor's COVID-19 Vaccination Task Force, followed by some questions and answer sessions. Members of the public can enter their questions at any time. Just click on the bubble icon for Q&A on the bottom of your screen, and it'll open up a dialog box and you can enter your question at any time. We'll keep an eye on the questions and answer them as we go through our meeting, and as well as a special Q&A at the end of the town hall. And just lastly, before I turn it back over to Mayor Rilling, the town hall tonight is being broadcast on Zoom and YouTube. It is also being recorded for future airing on our local cable access channel, Channel 79. It will be saved on the City of Norwalk YouTube channel, and it will also be posted on norwalkct.org for future viewing. Thank you, Mayor.
Thank you, Josh. So as we started out, we basically gave information on the state of the COVID-19 in the city of Norwalk. The state of Connecticut, for the most part, the entire state, is in what they call the red zone, based on the numbers of COVID-19 cases that they have per 100,000 residents. So it was started out with probably 6 or 7 different communities that were in the red zone. And over the past month, I believe it's now 166 communities are in the red zone out of the 169 communities or municipalities in the state of Connecticut. The task force was formed again so that we can make sure that we have everything in place when we start administering the vaccine, that we have the places that we're going to be administering the vaccine, who's going to be administering the vaccine. Some of our form public and private partnerships so that we can make sure we administer the vaccine to as many people as possible, virtually everybody that wishes to take the vaccine. The other point of the task force is, as I mentioned, is broken down into two prongs. One is logistics and planning and logistics, and the other is communications and outreach. We want to communicate to the public. We want to give the public the information that they need. We want this to be a transparent process. We want it to be an open process, and we want to be able to give people the information that they would need in order to feel comfortable with taking the vaccine or to make an informed decision as to whether or not they want to take the vaccine. So what I would like to do now is introduce the members of the panel that we have on tonight. As you know, I'm Mayor Rilling, and you just heard from Josh Morgan, my communications director. And now I'm going to ask Lamont Daniels to introduce himself.
Good evening, Mayor, and good evening, Norwalkers. I'm Lamont Daniels. I serve as the Chief of Community Services for the great city of Norwalk. Thank you, Mayor.
Thank you. Reverend Lindsay Curtis has joined us. Reverend?
My name is Reverend Lindsay Curtis, pastor of Grace Baptist Church, with a great concern on how we dispense this vaccine, both as a state and as a city. And I want to thank Mayor Rilling for asking me to participate on this task force.
Thank you, Reverend. Deanna Diamore, my director of the health department. Deanna?
Good evening, Mayor. Good evening, everyone. As Mayor Rilling just said, I'm Deanna Diamore. I'm the health director for the city.
Teresa Argandesi.
Good evening, everybody. I'm Teresa Argandesi, the health educator at the health department.
Brenda Wilcox-Williams.
Good evening, everyone. I'm Brenda Wilcox-Williams. I'm the Chief Communications Officer for Norwalk Public Schools, working closely with the superintendent, and we all look forward to supporting this effort and to doing our best to keeping schools open.
I'm trying to see if I see 29 participants, but I'm not seeing who they are. So is there anybody, I don't know if we have any of the council people on, or any of the council people on? I know we have, I see David Hoovelman as listed as an attendee. David Hoovelman is a counselor, a member of the Common Council. He's also on the task force. My chief of staff, Alicia King, is on. And I'm trying to say, I don't see any other council people, but if they join us during the meeting, we certainly will have them introduce themselves so that everybody is familiar. I think I just lost everything. Okay, I thought I'd lost everything. I'm back. So that everybody is familiar with the participants and who they can reach out to should they have any questions. So now I would like to introduce my Director of Health, who you've heard from, Deanna Diamore, and Dr. Orlenik of the Norwalk Hospital. If you would give us your presentation.
Sure. Thank you, Mayor. I'll start. I'm sharing my screen right now. Are you able to see my screen?
Yes.
Okay. Good evening, everyone. Again, we wanted to start off with just going over some basics about the COVID-19 vaccines. So as Mayor Rilling has mentioned, there are 2 vaccines that have now received emergency use authorization from the FDA. We have the Pfizer BioNTech vaccine, and we have the Moderna vaccine. The Pfizer vaccine is administered, both are 2 doses, they're part of a series of vaccines. You receive 2 doses to complete the series. The Pfizer vaccine has to be given 21 days apart, and the Moderna vaccine is given 28 days apart. The manufacturers of these vaccines reported that phase 3 trial results demonstrated that both vaccines were approximately 95% effective at preventing COVID-19 disease. And both vaccines have been tested in diverse adult populations that include older adults and as well as communities of colors. The clinical trial data show that both vaccines are safe and effective at preventing COVID-19, but it is currently unknown how long the protection from these vaccines might last. And so the research will continue as to determine how long the vaccines and that protection will last. But we know that it's been proven to be effective at 95% at preventing COVID-19 disease. This slide shows some of the information about the trials that have been conducted. And so we know many people want more information about these trials that have led to the release of these vaccines. So as of November 30th, 2020, there were more than 43,000 volunteers who enrolled in phase 3 of the Pfizer vaccine trial. They received the doses, and these trials were conducted at approximately 150 sites domestically and internationally. 39 US states were included in this. And this slide also includes some information about the racial and ethnic distribution of the vaccine. So 13% of those who participate in the trials are Hispanic, 10% African American, 6% Asian, 1% Native American, and 45% of those in this trial were ages 56 through 85. Now, for the Moderna vaccine, there were more than 30,000 volunteers enrolled in phase 3 of the trial. There were approximately 100 sites across the United States, so 89 within 32 US states. The breakdown for those participants, there were 20% Hispanic, 10% African American and Black, 4% Asian, 3% of others, and 64% of those in the Moderna trials were age 45 and older. 39 were between ages 45 to 64, and 25% were ages 65 and greater. These vaccines are mRNA vaccines, and they are expected to produce side effects after vaccination, especially after the second dose. And so the side effects with these vaccines are very similar to other vaccines. So people might experience a fever, they might experience a headache, they could get some muscle aches, but there were no significant safety concerns identified in the clinical trials. And typically these side effects resolve quickly, within a day or two. And at least 8 weeks of safety data were gathered in the trials. And it is known that it's unusual for side effects to appear more than 8 weeks after vaccination. So a lot of these side effects that I just described are, like I mentioned, are typical of other vaccines, like, the flu vaccine. You might know if you get the vaccine, you might have some soreness at the injection site for a little bit. So it's very similar to that. There are some consideration with these vaccines. In particular, if you've had active COVID-19 infection, it's recommended that you wait until you recover to get the vaccine. If you've had known exposure to COVID-19 or you've had close contact with somebody, you have to wait until your 14-day quarantine period is over until becoming vaccinated. For those who have underlying medical conditions or are immunocompromised, it's important to talk to your doctor, your medical provider about that, but there are no known precautions related to that. We also have been getting some questions from pregnant or nursing moms. There is no data available from the trials regarding safety in pregnant women. And so again, we advise people to talk to their doctors about this. But the American College of Obstetricians and Gynecologists have said that they don't think that vaccines should not be withheld from pregnant and nursing individuals that meet the eligibility for vaccination. Another important consideration for the vaccines is that there's not research on whether if you've had another vaccine, how that will impact the getting the COVID-19 vaccine. So you must wait at least 14 days before or after getting another vaccine. So if you were to get your flu vaccine and you also wanted your COVID-19 vaccine, you would have to wait 14 days in order to do so. And then I'm sure people have been seeing in the news related to, allergies and considerations. There have been rare allergic reactions to the vaccine, and the National Institutes of Health is actually launching a study on this to understand, what could be causing this reaction. So if you have a history of severe allergic reaction to any of the ingredients within COVID-19 vaccine, it's not recommended to receive vaccination at this time. If you have had a history of severe allergic reaction to other vaccines or injectable medicines, you should talk to your doctor to discuss those risks. And for those people that have had those reactions, there's a 30-minute window built in to have an observation period once you do get vaccinated, so that you're under close monitoring after being vaccinated. And then if you have allergies to other substances like food or pets or other medications, you can proceed with vaccination. But there is a standard 15-minute observation period that with anybody who's getting the vaccine, they'll be asked to wait for 15 minutes so that a clinician can observe them to make sure everything is good. And just something to note that all vaccinators are trained and prepared to address any allergic reactions. And so that we've received the guidance from the CDC and about specific instructions related to it. And, vaccinators are prepared to address any reactions. And this is just a reminder that no vaccine is 100% effective and protection is not immediate. It can take 1 to 2 weeks after the second dose to be considered fully vaccinated. And we also know that it's going to be some time before everyone is going to have access to the vaccine. So just a reminder, it's important to always wear our masks and our face coverings, to cover our nose and mouth, to keep our physical distance, and to keep washing our hands in the months to come. So I know a lot of people are wondering, when can I get access to the vaccine? So while the supply is limited, the CDC's Advisory Committee on Immunization Practices and the Connecticut COVID Vaccine Advisory Committee and the Governor's Office, they've set these priority groups, and they've prepared a phased-in approach to vaccine. So phase 1A has started now, and the people that are included within phase 1A are healthcare workers, those within long-term care facilities, nursing homes and assisted living facilities, and the staff that work in those facilities, as well as medical first responders. So that vaccine, that phase has started in Connecticut. And there are other phases that are being currently outlined right now. Phase 1B, the CDC's Advisory Committee on Immunization Practices met this weekend to determine who falls within phase 1B. And currently the Governor's Office and the Connecticut COVID Vaccine Advisory Committee is looking at that, and they will provide those recommendations for what that means for Connecticut. But the CDC has included adults over the age of 75 and frontline essential workers. We're still waiting for additional definition of frontline essential workers and how Connecticut will interpret that. But some people that are included under that group that the CDC has listed have been, other first responders, potentially people working within public schools, grocery store workers. There's a whole list of potential groups within that could be included within those frontline essential workers. Phase 1C, again, this is all subject to change and all subject to federal and state guidelines, but we believe that phase will include adults 65 to 74, those who are 16 to 64 who have medical conditions that put them at risk for severe COVID-19, and other essential workers. Phase 2, that's everybody else. So anybody else under 16 and those that are remaining over 16. So it's important to note that the vaccine is not expected to be widely available until this summer. And so phase 1B the governor mentioned in his press conference this week, it could begin starting at the end of January. Phase 1C could begin potentially springtime. Again, these are all moving targets, they're all moving, but this is that currently where it stands out in the rollout. And then just to conclude my slides, we're working really closely with the Connecticut Department of Public Health on this. There are several local vaccinators that are preparing for vaccine and or doing it currently. Norwalk Hospital, who's on this meeting, which will talk about their plans. The CVS and Walgreens pharmacies are supporting the vaccination of the long-term care facilities. The state health department is currently onboarding the federally qualified health centers as well as other health departments. There are currently 21 local health departments across the state that are being onboarded, and more will be coming in the future. We're working really closely, within our department and our different divisions within the health department. Really excited to be working, to support the mayor's COVID-19 vaccination task force and all the other community partners in this effort. It's really going to take a community to get this work done. And we're anticipating to get the vaccine at some point this week, and we could start vaccinating as early as next week to start. And we'll be expanding our capacity as the weeks goes on. Thank you, Mayor.
Thank you, Deanna. And I believe now that the next speaker or presenter is Dr. Orlinik from the hospital. Doctor, thank you for joining us this evening.
Great. Thank you, Mr. Mayor. So my name is Jason Orlinik. I dropped off the Zoom call briefly because I had some connectivity issues and computer issues. I apologize. We started our vaccination clinic at the hospital on Friday of last week. And we immunized on our first day about 135 healthcare workers and employees who are forward-facing with patients. That's continued this week, and we're immunizing 3 days this week and 3 days next week because of the holidays. And then we'll be doing it 5 days a week going forward. As Deanna mentioned, healthcare workers, are sort of at the top of our list, in addition to nursing facilities, and those are being managed mostly by CVS and Walgreens through state contracts. So we're expecting to immunize about 600 to 700 patients, employees or members of the medical staff each week. And over the course of about 6 weeks, we should be done with about the 2,000 members of Norwalk Hospital who interface with patients on a regular basis. So we're pretty excited. We got our first doses of the Pfizer vaccine, which is the one that needs to be stored at around minus 80 degrees. So that requires special freezers. We make several runs a week up to Danbury Hospital, where the freezers, our sort of centrally located freezers are at. And then we bring them down to Norwalk. We keep them in a refrigerator. It could be kept for 5 days there. And then once the vaccine is reconstituted, it has to be used within 6 hours. We use something called the VAM system, VAMS, which is a CDC medical record. It's all very highly regulated by the federal government and by the state government as to who is eligible and the information that goes into that system. And so I had my vaccination last Friday, and I can tell you that I felt actually great afterwards all day. I had a little bit of arm pain, and then on Saturday, by the end of the day, the arm pain was gone. I didn't have a fever. I had a little bit of a headache, but that's probably my regular headache that I get from stress. And otherwise felt really well. Most of the side effects come after the second vaccine, which for the Pfizer vaccine is on day 21. So I'll be getting vaccinated again in a little less than 3 weeks. And after that vaccine, I'm expecting that I might have a fever or some joint pains or muscle aches. Almost kind of what you get when you get sort of an infection, an upper respiratory infection during the winter. We are planning to get a Moderna vaccine, and that's the second that was just recently approved. That's a little different. It's the same technology. It's an mRNA vaccine, but you give the booster dose at 28 days. So it's going to take us about 6 to 7 weeks or so, we think, to actually get all of our staff done. And that includes physicians and nurses and respiratory therapists and EMS, dietary, environmental services. There are so many people that take care of patients in the hospital. that interface with patients that you don't even think about that are really at high risk. And so we're immunizing all of those people first. And then once we're done with that phase of the immunization vaccination process, we're going to work closely, obviously, with the state and with some of our community partners to see where the next need is. And I assume that we'll be moving on to 1B and then subsequently 1C. But I think a lot of this is going to be managed, I think, through probably the Department of Health in Norwalk, the DPH, CVS, Walgreens. But you know, we felt very strongly that we needed to start doing this so that we could keep our staff safe, so that we could be here for our community.
Thank you, Doctor. I appreciate that. I think you had the headache we all have this time. This pandemic has given us headaches all along. So thank you for your presentation. Next, Josh Morgan, the Director of Communications for the City of Norwalk, and his group will be talking about community outreach. We have Brenda Wilcox-Williams, who's the Chief Communications Officer for Norwalk Public Schools, and Teresa Argandesi, the Health Educator for the Norwalk Health Department. So Mr. Morgan and staff.
Thank you, Mayor. I have a brief slide deck to go through, so I will share my screen, and hopefully folks can see this. So again, good evening, everyone. My name is Josh Morgan. I'm the Director of Communications for the City of Norwalk. It's a great honor to be here tonight with my colleagues Brenda Wilcox-Williams from the Norwalk Public Schools and Teresa Argandesi from the Health Department. As the Mayor said, communications and outreach is one of the subcommittees or one of the arms of his COVID-19 vaccination task force. Members of this subcommittee represent cross sections of the community, folks who are here tonight, city and school staff, also our local elected officials, and community and faith leaders, such as Reverend Lindsay Curtis, who is here on the call tonight. We're going to be tasked with providing accurate and timely information. We're in the process of creating a dedicated landing page on the homepage of the city website, which will be updated frequently. And we just have created a dedicated email address, COVID-19 Task Force at norwalkct.org. And that is a general inbox where residents, members of the public can submit their questions, comments, or concerns, and we'll be able to triage that and have it go to the appropriate staff for a quick response. And one of the things that we're really going to be focused on is pushing back and fighting the deliberate and perhaps unintentional sharing of misinformation. We know that there are bad actors, maybe some foreign adversaries trying to sow dissent in federal and state and local governments and across the United States. Also being aware of social media bots, online trolls, people who are get enjoyment out of sharing misinformation or misleading updates, and being mindful that there could be scams as well of people trying to take advantage of those looking for legitimate information. Just some recent headlines. Pfizer's vaccine causing infertility, social media companies losing the misinformation fight, social media not able to shut down vaccine misinformation. So this is ongoing, it has been, and we expect it to continue into the weeks and months ahead. So really what this committee is going to be doing, you know, we're going to have to address some skepticism and also answer some of the unknowns as we move forward. You heard from Deanna Diamore and Dr. Orlinik, sort of the medical side of things. You know, what is the COVID-19 vaccine and what does it do? Is it going to be safe and should I get it? And if I want to get it, where do I go and how do I obtain the vaccine? So really this group is going to have to set some expectations and have some clear information. The phases on who gets vaccinated and when is being set by the CDC, the state, the Department of Health. And you know, just to reiterate, the vaccine is not expected to be widely available until this summer. And something that this group is going to be extra mindful of in our communications outreach is recognizing the history in Black and African American communities, and being aware that the Latinx communities and others may have mistrust in the government. Things we want to consider is the medical mistrust and the history of research abuse and exploitation of communities of color. The Tuskegee experiments are just a generation away, very top of mind for many in the Black and African American community. We know that birth control has been unknowingly researched on women. So we want to be mindful that the vaccine is safe and it's trusted. But we want to make sure that we're sharing the information that's important to our communities. And also of what the government is asking, what are people going to be required to submit on a form? Where is that information going to go? We know that those who are undocumented may not seek out a vaccine if they have to provide certain information because of fearfulness of retaliation or how that information would be used against them. And again, just some headlines that are out there in the media about hesitancy about getting the vaccine, mistrust. Are people going to be trusting the government, the scientists, and especially being mindful of the communities of color who are being disproportionately impacted by COVID-19. And I think that's important just to recognize that this isn't a one-size-fits-all communications and outreach strategy. We're going to have to tailor our messaging to certain segments of the population and how we get that word out there. But we also need trusted messengers and voices, people who live in Norwalk, people who are reflective of the diversity in our community. We need you to share your story and share your opinions. People are more likely to trust their uncle, their friend, their pastor, their faith leader, people that they know, more than maybe something that's posted on a government website or they read in the newspaper. So we're going to be encouraging people when they receive the vaccine to share their experience, like Dr. Orlinek stated earlier about his experience and sort of his feeling. We need to have those honest conversations and share that widely so people know what they expect and they're hearing it from people who they trust. But again, we don't know everything, and we'll admit that. So please reach out to us. Again, please use the general email box, COVID-19 Task Force at norwalkct.org. Send us your ideas, your suggestions. We want to hear your questions, comments, and concerns, and we'll make it a point to incorporate those informations into a frequently asked questions document. We want to know what the community is thinking, what the community is hearing, and that will help inform our strategy moving forward in the weeks and months ahead. So thank you so much, Mayor. Appreciate the opportunity to be here tonight. And I'll turn it back over to you. And we do have some questions coming in that we can start answering and addressing in a little bit. So again, thank you so much, everybody.
Thank you, Josh. So as you can see, both of these prongs of this task force are very, very important. One, to make sure that the resources are available so that our team can work, so that the providers of the vaccine have a place to administer the vaccine, have the tools, the staffing, everything that they need so that they can administer this effectively and efficiently. Also, as Josh just went through, we need to make sure we get word out to the public. Public needs to know that we're working hard. They need to trust the information that we're putting out. And we want to give information so that they can make an informed decision. But we also want to let them know timelines so that they don't have any unrealistic expectations. We want to let them know the different levels when they're going to be eligible to get the vaccine. So I just want, okay, I've been asked to start my video. Sorry about that. So we want to make sure that we get all the information out. The information in something like this is really, really critical. And one thing that we need to make sure that people understand is that by no means does this mean that the pandemic is over. This is continuing. Will probably continue into a good part of next year. So we don't want people to start relaxing, not wearing face coverings, not wearing masks, not doing their social distancing, not washing their hands, and avoiding large crowds and so forth. So now I want to introduce my Chief of Community Services, Lamont Daniels, who will be talking about community partnerships. We have, I don't believe Darlene Young, the District B Council member, is on the call, but she is a part of that leg of the task force, and Reverend Lindsay Curtis from Grace Baptist Church. So Mr. Daniels.
Good evening again, Mayor, and good evening, everyone. So I'll be brief. The message I want to share with the community today is that we'll be working very closely with Josh's team, the Communications Subcommittee. While we'll be using all of our city assets, we certainly recognize that some of the technology many communities may not have access to, which is why we will be relying on our community partners. And as you heard, we're going to call it out. We know communities of color, from a historical context, is very concerned, very uneasy about the vaccine. So this is why we can't do this alone. So it's going to really be a partnership, both from on the city side, but identifying key partners, key community stakeholders to support us, to dispel the myths, to provide accurate information and also reliable sources. So we'll have a strategy in being very intentional, working with our nonprofit community, our social service community, most certainly our faith-based community, which I'm really excited. Reverend Curtis is here. He'll share a few remarks right after me. And then our civic groups. And Josh shared an email. So we encourage any association, any cultural group. We'll also be working with our Hispanic and Latino, the La Palomero essential workers from Peric. Apple couldn't be with us today, but they are very much involved, as we want to make sure we're reaching all groups who are concerned, who are wary about the vaccine. So I'm just excited to offer and be a part of the team, but also to make sure that we continue to work with everyone as we roll out this strategy. So thank you, Mayor. And I guess I'll ask Reverend Curtis to share some remarks, and then we'll go right into Q&A afterwards. Good evening, Reverend Curtis. Good to see you.
Good to see you too, Lamont. Again, thank you, Mr. Mayor, for including us on this task force. I also want to mention the president of the Interdenominational Ministers Fellowship, Dr. Richard Clark, pastor of Bethel AME Church, and Brenda Penn Williams, who is Norwalk's NAACP president. Our concern is to ensure, and this is not to suggest otherwise, but we want to ensure that there is equity in the distribution of this vaccine. Now, the issue is communication. The issue is communication. So I'm appreciative of Josh and Brenda Williams and others that will take the bull by the horn and make sure that we communicate as much as we can. Having a corporate background, I do know that it's communication, communication, communication. I saw on a cable network the other day that African Americans are 3 times likely to die compared to our white counterparts. We are nearly 4 times likely to be hospitalized. But yet we are 57% against taking the vaccine. As it has been stated earlier, we understand the mountains there that are yet to be climbed. We understand the hesitancy. We understand the historical perspective. So we will be doing a lot of communicating and sharing. I also want to suggest that you don't have to take my word, you don't have to take the mayor's word, you don't have to take anyone's word on this task force if you don't want to. But what we would suggest is that you have a serious conversation with your physician. Most of us trust our doctor. If you don't, then perhaps you need to get another doctor. But we certainly want to suggest that that's where the conversation begins. But understand it's not just about you, it's about your family. It's both those near and far. So I know that the mayor and this task force will continue to push out an effective communications program, and you'll understand and have all the who, what, when, and where. So again, Mr. Mayor, thank you for the opportunity of participating.
Thank you, Reverend Curtis, and certainly, hold on. Thank you, Reverend Curtis, and thank you for being a part of this task force as well. Probably about a week and a half or 2 weeks ago, Reverend Curtis reached out to me with concerns about the equity of the administration of the vaccine, and rightfully so, and wanted to make sure that we were moving forward. And I told him that we were having a meeting that particular day that he called, and that we would be forming this task force. And as you can see, this task force is made up of a variety of people in the community, people from various backgrounds, people with significant degrees of expertise, but also people who are what we call the acknowledged leaders in the town, not the elected leaders, because a lot of times people don't always trust elected leaders, but they do have leaders that they look up to, that they acknowledge as a person in the community who they can trust and that they can reach out to if they have any concerns. So we wanted to have a wide variety of people involved so that we can get the word out to as many people as we possibly can. And again, the whole key here is an informed decision, being able to make a decision that you feel comfortable with and that you can trust. And I do want to thank everybody on this task force. Now, I know we have what I see, it looks like about 11 questions. So I'm going to ask the communications manager, Josh Morgan, to read the questions, and then we can determine who would be best suited to answer. Josh?
Thank you, Mayor, and thank you everyone for tuning in tonight. Just as a quick reminder, if you'd like to ask a question, just hit the Q&A button on the bottom of your screen, and you could submit a question to any member of the panel for us to discuss and answer. And if we don't know an answer, we'll certainly research it and get back to you. So we have a question here, Mayor, and this is probably directed for our health director and maybe our health educator. Is the State Department of Health vaccine considering putting those who are 65 years or older, as well as younger folks who are at higher risk because of medical conditions, back into phase 1B? They were originally in Connecticut phase 1B, but got pushed back to phase 1C based on some new guidance. So I'll ask Deanna or Teresa what you're hearing about the phases. Thank you.
Sure. So the allocation subcommittee of the governor's, vaccine advisory group met yesterday, and they had that discussion, and they're going to be continuing that discussion. So we don't have a clear answer. I know there were some concerns related to that about, these are the recommendations from the federal government, but are there any others that we feel like need to be included within Connecticut? So I know they're considering it. I don't know what ultimately their decision will be, but hopefully we'll have some more clarity about that within the next week or two.
Thank you, Deanna. We have a question. If I already had COVID-19, do I still need to get the vaccine? So Deanna or maybe Dr. Orlinek, could you address that of someone who has tested positive for COVID-19, and should they be getting a vaccine or do they need the vaccine?
So it's Dr. Orlinek. Was the question, if you've had COVID before, should you get the vaccine?
That's correct.
Yeah, so that's a very common question that we get, and we get it from I get it from physicians, I get it from nurses. So it's not just folks in the public who are asking this question. I've got docs asking me. So the recommendation from the CDC is that you should get it because we don't know how long natural immunity will last. The other question we get is how long should I wait after I've had it? So some people feel like they need to wait several months. And you can. So the CDC is now saying that you can wait up to 90 days to get it because the likelihood that you would be infected between now and then is actually low. But you can get it, and I think should get it, in my opinion, as soon as you start feeling better from your infection. So I would say at least 2 weeks have passed since you've gotten it. There is no defined timeline. And the reason why I say that is if you are eligible to get the vaccine now and we have it in hand, I would just take it when we have it. We're assuming that the flow of vaccine is going to be plentiful and that we're going to see more and more of the Moderna and the Pfizer vaccine and maybe others as time goes on. But if you have the opportunity to take it and you've had COVID, I would take it as soon after you feel as back to your kind of self as you can. I wouldn't wait too long.
Great, thank you, Doctor. We have a couple questions in the chat about public vaccination clinics. How do people get vaccinated? One specifically, for those of us who do not have a primary care physician, will the city be providing us the vaccine? It's still unclear to who we should be waiting to hear from to get vaccinated and who is going to track our second dose. Deanna, would you be able to answer that question, please?
Sure, and Teresa, please help me add any additional information. So, and Josh, I'm trying to remember all the questions. So one of them was related to if you don't have a primary care physician about access to the vaccine. So during these first phases, it's it's very controlled over how you get uploaded into the system and get invited to schedule an appointment for a vaccination. So right now it's being done through employers. So if you're a healthcare provider, your employer is putting your information so that you can then get the vaccine. And so on the governor's press conference this week, they talked about, within the next phases, for those who are those frontline essential workers, we think it's probably going to be a similar process where it's the employer that's inputting the information, and you'll be able to look to see what are the available vaccination clinics. But as we move forward to those other phases where it's going to be more widely available, there's still a lot that needs to be done in terms of the planning for it. But yes, like we are anticipating the health department in the future when it becomes more widely available for those who don't have access to a medical home, they don't have a doctor, we want to be able to provide that access to the vaccine. And I'm sorry, Josh, can you remind me what the other questions were?
Oh, yeah, sure, absolutely, and thank you for that answer. How the tracking is for a second dose, being mindful that this is two doses for the vaccine. So how will someone be tracked or get a reminder about the second dose?
Yeah. Teresa, can you talk about the VAM system, and then we can talk about our own EMR as well?
Sure, absolutely. So currently in these early phases, as most vaccinators are using the VAMS system, which is the federal software system where folks are making their appointments, they're getting registered to get their vaccine. The recipients, after you get your first dose, you'll get an email reminder to make your appointment for a second dose. And so then you'll do the exact same process where you'll register looking for an available clinic in your area. There will be certain clinics designated for second dose, so folks who have already been vaccinated once. And then they'll check against their record and make sure that they're eligible for that second dose. Once the vaccine becomes more widely available, depending on whether providers are using the VAM system or their electronic medical record or their EHR, EMR, those providers may make your appointment for you before you leave for your second dose, or perhaps follow up with you or give you a reminder card similar to how you would when you're scheduling routine visits after you leave the doctor's office. So the VAM system in the early phases will provide you with an email to prompt you to make your second appointment. And then as we get into later phases, and providers using their electronic medical record, it's very likely that they'll be able to make that, second dose for you, the second dose appointment for you right there on the spot.
Thank you,
That's great,
Teresa.
thank you. Thanks, Teresa. Thanks, Deanna. I know Lamont had sort of addressed this already, but we'll raise it up again because I think it's so important about our nonprofit groups, our neighborhood groups, our faith groups involved in this task force and helping get the word out. So Lamont or Reverend Curtis, if you wanted to jump in on that one, because it is an important question.
Sure, and Reverend Curtis, please jump in, but I think Reverend Curtis eloquently mentioned and shared, but more importantly from the city side, we definitely will need to rely on our community partners such as Reverend Curtis, the IMA, and other groups, and we're being very intentional. We have a pretty sophisticated nonprofit network that we'll also be relying on to share information, to provide information. I think the other piece is to ensure that people get the accurate information. I think the last piece is to be transparent to address those concerns, as Reverend Curtis mentioned. So there is planning and work involved to work with the nonprofit group, such as the family centers, the childcare centers, the community programs, services that are offered throughout the city, because they also have a perspective that we want to make sure as families and individuals are concerned, we want to make sure we're able to address them and encourage those who feel comfortable to get vaccinated. Thank you, Josh.
Yes, Lamont, I would only add that, first of all, this task force is concerned and would ideally love to see everybody, no matter of the particular demographic. But because of the preponderance of hesitancy and historical, that we've talked about it before, we are focused on trying to ensure that the African-American community has the necessary answers, has a sense of trust that this is not another research project, but that it is a project to keep all of us alive given this virus. And I would add that we probably have been all watching the news, and with this new strain that's coming out, I was listening to Dr. Fauci today. He took the vaccine today, I believe it was today. So this is, we're very concerned that everybody that desires to take this vaccine will take it. But we know, as I just gave you the statistic, 57% of African Americans nationwide have said that they're not taking it. And I have had and been faced with that resistance as well. Not personally, because when it's my turn, I will take it. And I'm encouraging my membership, I'm encouraging our community to take this vaccine. Now, as to who, I mentioned too, the NAACP, the Interdenominational Ministers Fellowship, in terms of African Americans. There are many other groups in town, the sororities, fraternities. We want to penetrate all of those avenues of contact. So this is not work for the weary, and we understand it. I mean, it's not being judgmental. We understand the history that African Americans have faced with regard to the health community. And so we're trying our best to counteract that. Thank you.
Thank you, Lamont. Thank you, Reverend Curtis. We have a couple questions in the queue here regarding communication, so I'll tackle them both at the same time and ask Teresa and Brenda to please jump in. How can people who aren't watching this town hall receive this type of information? Very good session. Are there medical experts on the Communications and Outreach Committee? Medical communications, a profession to help put technical, complicated scientific language in layman's terms. So I'll start, and again, Brenda, Teresa, please jump in. So, we are aware of a digital divide, people who may not be looking on Zoom or YouTube or the city website for information. So we will be thinking of creative ways to share information, whether that is a mailer, some flyers that can be handed out at events, potentially some advertisements around the city. And to the other question about medical expertise, yes, absolutely. Some of the materials that we receive will rely on our state partners to help us with some collateral materials. They'll definitely need to be distilled down into layman's terms to not be so scientific, but also to also be Norwalk centric and to be culturally appropriate for residents in Norwalk. So I don't know, Brenda, if you wanted to add anything maybe from the school side about communication with our young folks and our staff.
Yeah, I just, Josh, you've covered a lot of it, so I just wanted to reinforce that we will be using our school communication networks.
Oh, Brenda, you're a little hard to hear.
Sorry. We will be using our school communications networks to get information out to the community. But I also just wanted to emphasize as well what Josh had said earlier, I think he touched on. We will also be getting information out in multiple languages as well, to make sure that folks who perhaps do not have English as their primary language have information that they can understand and digest as well. So.
Great, thank you. Have a couple questions about the vaccine. One, should teenagers be getting the vaccine? Deanna or Dr. Orlick, can you talk about maybe the latest guidance that you're seeing in terms of who should be vaccinated and the ages at this point?
Oh, I had trouble getting myself off of video. I apologize. There was a question I saw about whether or not teenagers should be vaccinated. I think that was the reference. So the Pfizer vaccine actually went down to 16 and 17-year-olds. So they included some teenagers in that. Moderna only went down to 18, but both are actually being studied currently in teenagers to establish safety. It's not uncommon to start actually a lot of these trials in the adult population, not wanting to subject kids to safety and efficacy trials. So this is a pretty normal thing to do. Kids weren't excluded on purpose. It's for their own safety. And if you think about it, I was just chatting with my spouse about our kids and whether or not we would have allowed them to participate in a vaccine trial. And I think the answer is most certainly no. And so at this point, it's a personal choice as to whether or not, teenagers at the age of 16 or 17 would get the Pfizer vaccine, but the Moderna hasn't been studied yet. So by and large, anybody under 18, it's going to be pretty rare for them to actually get vaccinated. That we'll probably have more information in the spring.
Great, thank you so much. And then we have a question here about a text messaging program being opted in automatically, and then people can opt out. That is definitely something that we are looking into, not just specifically for the COVID vaccination task force in this pandemic, but also thinking of the natural disasters, the blizzards, the hurricanes that affect our community. So that is definitely something that we are exploring to use a little bit more. And just have another question here. Can you speak a bit more about the severe allergic reactions, about the Pfizer vaccine? Has there been any reactions to the Moderna vaccine, and how rare are these reactions compared to maybe other more common vaccines like the flu?
So I'll take that one. So in both the Pfizer and the Moderna studies that were done, they did not see allergic reactions. It was only after Pfizer was rolled out in the United Kingdom that they saw a couple of healthcare workers develop this early on. And so that kind of got our attention. And then, we've seen some evidence of that in the United States. And so that's also not atypical as you roll it out more broadly, to actually start to see some very infrequent, let's say, side effects or unintended adverse events. And so we do see this. I think the protocols have been very safe. So far in Norwalk, we've immunized about 500 employees and members of our medical staff, and we haven't had anybody who's had any reactions. And the typical observation period is 15 minutes, as I think Deanna alluded to, after getting a vaccine. But if you've had a history of allergies, we have things like EpiPens and medications to treat that, and the observation period is 30 minutes.
Thank you, Doctor. And thank you again for those who have tuned in tonight, asked your questions. We did get through all the questions. Were a couple of repeats. So I hope we were able to address those. Again, just before I turn it back over to Mayor Rilling, just to remind folks to check the city website for information. And again, if you have questions, concerns, comments, please do send us an email, COVID-19 Task Force at norwalkct.org. And that will go to a multitude of different city staff members, and we can get the answer and get back to you in a timely fashion. So thank you again. And Mayor, I will turn this back over to you.
Thank you, Josh, and thank you to all the panelists for agreeing to participate in this very, very important endeavor. As we know, as I mentioned earlier, this is kind of light at the end of the tunnel, we hope, but it's not the end of the tunnel. We're still in the pandemic, and we will be most likely for quite some time. But with the vaccine and with people still continuing to practice social distancing, to still practice the wearing your face coverings at all times when you're out in public or in a group of people, washing your hands and doing all the things that have worked to a degree, but this will continue. And even after you get your first dose, we've been told that you should still continue, and even after your second dose, to continue until we eradicate this vaccine in total once and for all. Now, over the next couple of months, as we start to roll out the vaccines to the different levels, we're going to be doing some more town hall meetings. And I know one of the questions was, how do people know about the town hall meeting? And then there was the question about the opting in for text messages. Well, we do have Code Red, which is a reverse 911. And before we do any further town hall meetings, we will do a Code Red to make sure that we get the information out to as many people as we can. And anybody who wishes to sign up for the Code Red messages can do so on our city website. It's very, very simple thing to do. You can use your home telephone number. You can use your cell phone number. I believe you can also use your email address to get Code Red messages. So information is key. Information here is key. And again, stating what our purpose here is, we want to make sure we give people information that they can make informed decisions. Not only that, but where they can get the vaccine, when the timing is, and we want to make sure that once a person gets vaccinated for the first time, they come back within the 3 weeks or 4 week period of time, depending on whether they got the Pfizer or the Moderna. So again, I just want to thank everybody for being a part of this task force. And also, I just want to wish everybody a very Merry Christmas. We've happy Kwanzaa, and certainly a healthy and happy and prosperous 2021. During the 2021 year, we are praying and hopeful that this vaccine will be a thing of the past. So again, thank you everybody for participating. Thank you for those members of the public who opted in, who signed in. Again, good night and thank you.